For many years, we thought it was a limitation of the EHR. But as the EHR was progressing, we started finding out that maybe it's not the EHR, it's the inability of the patient to actually know how to utilize those resources.
So with our organization and our patient base being so rural and underserved, we knew it'd be beneficial so they could be more involved with their healthcare, accessing the patient portal so they could communicate with their care team, transportation issues. When there's too much snow on the ground, they can't drive, they can set up virtual visits.
What we did was we aligned the digital navigation project with our strategic objectives. It was a broader program to be able to expand access to care to patients who had barriers to get into our clinic, in person.
I think one thing that was really beneficial about this program was that it not only supported the workflow development of how do we better identify our patients who are struggling to access this, we also were able to respond with devices to those for whom that was the barrier, rather than creating a single role that would do this so everyone would have to refer to that person. We tried to create systemic screening and referral pathways so that it was not dependent on a specific person or role, but really kind of baked into the work that we do to support all of our patients.
It's reaching out to those patients that we didn't think we would have any connections with. Just knowing that you can connect patients with technology, that's been one of the best things ever.
Over 96% of patients who got a device or got literacy support from the navigator have been able to sign up for a portal and logged into their portal, which means that over 96% of beneficiaries have been able to connect with their care team through the patient portal. I mean, it's surprising to see that if patients are empowered and educated, they will use some of these platforms to their benefit.
What has surprised me the most is just, again, how comfortable our clients are with it, like how they're so willing to actually engage in their healthcare more than ever now. I definitely have seen them more integrated into their own healthcare and taking measures into their own hands.
It's something non-threatening that kind of gets the patients to start conversating with the care teams, and then those other needs open up.
An example that we were talking earlier this morning was a client whose blood pressures kept spiking up. They kept spiking up, and it's like, okay, what's going on? Well, it turns out this client didn't have access to food. The food that he would access, it was only food banks, or it was, just food that was cheap, easy. So we were able to connect him to WIC. We got that WIC app. We got him connected to SNAP benefits.
There should be no difference, no distinction between having access or not access to internet based on income level or education level.
If you care about your patients, you're going to want to bring digital navigation forward, because this is just a stepping stone for them to evolve, to be better, to be healthier, to be the best versions of themselves.